I want to talk to Kathryn now in Wakefield. She got in touch with us today. She also happens to be the Chief Executive of the Social Care Institute for Excellence. Hi, Kathryn.
Hi there.
You're worried, aren't you, about access to this test?
Yes, I mean, we've been talking about this for quite some time now, particularly in the social care sector. You know, we've got people working in care homes, people in home care, in special schools and in various other places where they're just not able to access the testing in a timely and regular enough fashion to be able to keep themselves and the people that they're working with safe. And that we have had some positive stories. You know, I have heard from care home managers who've managed to use the online system and get the testing results back very quickly. But equally, we've had many contacts from people who have the opposite experience, where one care home's contacted us where they tested all of the staff. It took 10 days for the results to come back, and they've had no testing since. Now, of course, the testing is only as good as the day it's done on. So the testing needs to be regular, especially in care settings.
And are you saying regular and asymptomatic, that we just need to be basically, you know, getting a picture of what's going on in care homes, regardless of waiting for people with symptoms?
Definitely. For care home staff and residents, definitely. You know, the care homes are unfortunately becoming incubators for this virus, or have become incubators for this virus. You've got lots of people living in close proximity who are more vulnerable to a disease like this because of pre-existing conditions and older age and things like that. So they need to be able to be testing the care home staff and the residents very regularly so that they can appropriately isolate and not continue to spread the infection. Of course, you know, the Social Care Institute for Excellence wants to see the social care sector improve. That's why we're here. And at the moment, this is incredibly difficult times for everybody working within social care. Even if you move, I've had somebody contact me as a head of a special school of people with learning disabilities, and she can't get testing in that school, and the children with learning disabilities are not able to socially isolate effectively. And then I had another colleague who attended a testing centre at the weekend, and there was nobody there. So there is quite a mixed picture out there. There are some very good positive stories, and we do recognise that there is some effort going in trying to improve this situation, but there is still a long way to go.
I just want to bring in Professor Sian Griffiths at this stage. Hi, Sian, how are you?
Hello, how are you? I'm fine, thank you.
Very well. Independent public health specialist, and has experience of testing in Hong Kong during the whole outbreak of SARS, and her expertise lies there as well. Sian, do you want to talk to Kathryn, and can you give her any advice or any reassurance, I guess, that, you know, what's going on at the moment is or will eventually be adequate to give a proper picture of what's going on in care homes?
Yes, well, I think, Kathryn, you would have heard yesterday that now anybody over 5 who has symptoms can apply to be tested, which is a good improvement. We have seen the capacity, the ability to test expanded very rapidly. And as you say, there are some people who have a good experience and some have not such a good experience. It's actually, we do need to also to try and pull together to make sure that the combination of mobile testing, testing at home, drive-through testing reaches out to everybody who needs it, because testing is such an important element of the release from lockdown. So I can fully accept that in the early days there have been teething problems. We now have many more people. We have a whole army of contact tracers, and people, they were able to recruit many more contact tracers than they thought they'd be able to. The contact tracing will be people actually within the Public Health England system who will be able to contact anybody who has contact the people who a case will have been in contact with, if you see what I mean. So we have more tests available. We have contact tracers. We have the promise of an app. Let's hope we can bring it all together.
But this is it, Sian. We're still a long way off bringing it all together. You know, we have the recruitment of the contact tracers, some of whom have received training, but they're not up and running yet. The system is not operational. We had problems around the app with Rory Catherine-Jones talking earlier about the fact that it doesn't incorporate test results yet. So it's not actually sending out any red alerts to people to tell them to stay at home if they come into contact with someone with coronavirus. So we are still some considerable way off this whole thing coming together, aren't we?
We are a way off it. I do accept that. But I think people are working incredibly hard to try and get the system working as efficiently as possible. And it's at a whole variety of levels. It's the national level. it's the regional level for Public Health England, and then at the local level, the Director of Public Health and local authorities are putting huge effort into trying to make sure that they can support the system and support local populations. So people are getting going. I can accept that it's not there as perhaps it is in somewhere like Hong Kong or South Korea, but part of the reason that you have more testing in some other countries is they have the capacity. And for example, in Hong Kong, having had SARS in 2003, they were actually ready to run with testing as one of their main ways of containing the disease right at the beginning of the epidemic. And maybe that's a big lesson that we have to learn in this country, that actually testing is a fundamental part of the whole process of the epidemic. So we need to really make sure that we get our skills and our supplies up to speed as quickly as possible.
Kathryn, do you want to come back on that at all?
Just to say that I would entirely agree with the efforts that are being put in to improve the situation, and with all of the examples that were given there. I think there is a lot of effort being put in. I think the underlying message here, or the underlying issue here for me, is that unfortunately social care was not thought of early on enough in the situation to be able to prevent this, and neither was the testing, as your colleague just said, that we could learn some lessons there. And what's really important now is that we do learn that lesson. We learn that lesson for the future. We recognise how important social care is for the whole system, to support the NHS, but to support people. And we recognise that in circumstances such as this, I heard you speaking earlier about this being a pandemic and this being unprecedented, and I accept this, but it's probably not going to never happen again. So we need to make sure that we really do learn these lessons. And in the meantime, that we are absolutely prioritising those that are working in social care settings and in the community in social care, because if we are not able to get social care support out to people that need it, then the consequences of that are much, much greater.
And can I just briefly, before we let you go, ask about peripatetic workers, those travelling from care home to care home, might be on 0 hours contracts, might not even feel they're able to take time off to go for a test. How do you manage that situation?
Absolutely, and this is a real issue both in home care. So many home care workers are moving between people's homes, between lots of different people's homes, and many care homes rely on agency workers or peripatetic workers, especially now while they're short-staffed, to keep their care home running. And again, regular testing is really important to that, and so is adequate PPE. Personal protective equipment, both of those have been quite difficult to come by. And I know from speaking to care home and home care providers that people are trying really hard to reduce the numbers of staff that move between different care settings. But to keep the staffing levels adequate, it just isn't proving possible to eliminate that altogether. And so appropriate infection control, personal protective equipment and testing is absolutely vital.
Thank you so much. Kathryn Wakefield happens to be the Chief Executive of the Social Care Institute for Excellence. Do you have confidence in the testing system?